So I had a patient who was very, very ill, and it got to the point where we really had to start discussing end of life. So they did decide at that point to terminally extubate, and I was still waiting for the hospice team, and the son just came up to me all of a sudden and said, okay, well, we're leaving. I thought, oh my God, this is the last time he's gonna see his dad, and I honestly didn't know what the right thing to do was, but I did know that maybe this guy, there's something to say. Maybe he was panicked. So I called hospice again, and Kelly Zersi was on. She made it down there in probably 3 minutes. And I swear, I don't know what she said, but when he came out, it was a complete change. And it changed from this very depressing, awkward kind of situation to, I really could only describe it as saying like a celebration of this patient's life. And he started blasting Johnny Cash music. Kelly called me on my cell phone and said, make sure they don't leave, I'll be down in a few minutes. This patient, at the end of the month, was gonna be inducted into the Hall of Fame here in Middletown for some sort of sports that he had done in high school or college, years ago. I don't know who she called, what she did, but she had the certificate that would have been presented to him at the end of the month. She had it faxed to her, and she framed it. She also somehow got a hold of old pictures of him. So she came down with this whole thing and basically presented it to the patient with the family at the bedside. And she came through for me, she came through for the patient, and she came through for the family. I see a lot of nurses doing amazing things all the time, and to make that much of a difference is pretty amazing.
So the patient came into the emergency department through the triage. He had expressive aphasia. He couldn't really tell us what was wrong. But the neighbor indicated that he had been abused by his caregivers, that he had 24-hour care at home, and the caregivers were abusing him. So initially, we didn't really know how we were going to help him. He didn't have a medical need. He wasn't in pain. He didn't have any fractures. We had very limited information on who was in charge of sort of helping him because he couldn't make the decisions himself. We didn't have anything listed for him for family. Ashley O'Brien became his nurse. She wanted to find out who his family member was. And at one point, he was sort of gesturing that his brother lived north. Finally figured out it was north, so she started naming off states north of Connecticut. Is he in Massachusetts? Is he in Maine? I think it finally ended up being Vermont. So the next step was to narrow down his brother's first name. So she started rattling off John and Robert and James and Michael and every name she could think of until finally the patient started gesturing and she had hit on his name. So she went then to Google and Googled the name and called every John Smith in Vermont and finally found the patient's brother. So I was just really struck by her creativity because I know that a lot of nurses cared for him over that weekend and he did receive very compassionate care, but she really went the extra step and was so creative in finding out who his family members were.
This gentleman had come in. He had been to our emergency room. He had been sent to Hartford Hospital. He had a full cardiac workup. Was discharged from Hartford, felt terrible, came right back to our emergency room. Katie Ben had gotten a report she was going to be his nurse. As soon as she met him, she knew that there was something wrong, that the picture that she had gotten was not the same as what was presented to her. So immediately she started to assess him. She called the doctor. The doctor had ordered some medication and just told Katie to continue to observe him. By this time, Katie had observed him and then we were changing shift and I picked up his care. So we had to be persistent and start taking different kinds of temperatures, and there was a huge difference. Then there were more phone calls to the doctor, and basically this whole process happened over a period of about 8 hours before we finally got to the conclusion that he was very ill. He ended up having a bad gallbladder. He ended up going to our intensive care unit and then to the operating room in the morning. Patients sometimes who are just so ill, sometimes they can't tell you what's really wrong. And they need nurses there to be their advocate. He grabbed my hand, the doctor had left, and he was like, thank you. Thank you for believing that there was something wrong with me.
So my wife and I are on vacation. She's telling me throughout the entire time that she's not feeling any fetal movement, any movement from our daughter. So when we returned home, we went over to Crescent Street OBGYN, where we saw Dr. Boney, and on that ultrasound, she noticed that there was a very low amniotic fluid level. Dr. Boney advised that we be urgently transferred up to UConn. Karen is an APRN here in our nursery, and she's also an APRN up at UConn in their NICU as well. We were there for several days, but this entire time in talking with Karen, she was always on that other end of the line, always able to answer any question I had and reassure me that she was getting the absolute best care and attention, which is all we needed. She went to her team, her care team up at UConn, and expressed to them, which we felt very uncomfortable doing, that we had become a little frustrated with the plan of care and what was going on. Came in the next day after I had that conversation with Karen. I get a call from 2 neonatologists. The nurses are all talking to us, the practitioners are swarming around, and we felt like we had a new understanding with everyone because of Karen. She was our advocate. You know, I can't say enough how meaningful that was to us during that time, to have a partner like that.
So Mary Ellen is one of our home care case managers. She is energetic, lights up a room when she walks in, dedicated. She knows her patients. She knows her team and what they need. She advocates for them. She's been with home care for 15 years, and she really is a crucial part of our program. So we have a husband and wife in the Middletown area who moved here from quite a distance, and when they came to Middletown, the only thing they had set up was residence, which the family had set up. Other than that, they had nothing. So Mary Ellen was one of the first opportunities they had to interact with the Middlesex healthcare system through home care. To quote the daughter, she said, when they moved, it was disastrous. But Mary Ellen took the time. She got all of their medications figured out in conjunction with the new doctors, and then beyond that, she also arranged for them to be part of the community by using community resources like the community senior center. The wife said, I just love Mary Ellen. I now feel like I'm part of this community and not just living here. The whole family actually said that she's like a family member to them. Rather than just coming in, checking their vitals, making sure they were okay and had their meds, she went above and beyond so that their well-being and their whole person is treated. No matter how many years of school somebody has, you can't teach them to have an empathetic heart and to really listen to people and to know what they need. You know, she takes the time to know and to be there for them.
A gentleman had respiratory distress on North 2, and his nurse, Jen O'Hare, had called an RRT, which is a rapid response, at the same time that he was a DNR, which basically means do not resuscitate, do not intubate. We really need to be looking at more of the comfort. Jen had basically turned to me and she said, Mrs. R is a patient up on North 6. It was basically all of us just at the same time realizing that it would be great to get her downstairs. Rolling her in through the door was just a relief and a sigh for everyone to realize that she had made it before he had passed. Jen had said that he had one son and basically encouraged them to call him. The unfortunate thing was the patient expired before he arrived, about 3 minutes, but he was comforted because he came in and saw his mom and dad together, holding hands, and Jen actually had commented that the patient earlier had said, you know, I'm ready to die. So somehow the patients can give you that message and you believe them because it's not going to be anything that we're going to alter, but we want to make it the best for them. Being in the hospital can be just caring, and it can be up until the end of life, and that's exactly what you said. We hope to have that happen. So I think with Jen, recognizing that this is where we are at the end of life, and then realizing that his wife is here as a patient, and, you know, again, trying to mobilize her as a patient in-house, and yet be able to come to be at her husband's side, was truly a remarkable story.
I was working with Nicole, and she had said to me, can you come in and help me with this lady? This was a patient who we all kind of knew about, very young lady. She had young children, stage 4 breast cancer, and was obviously dying. Her husband had been unable to make any decisions for her so far. And so that's a frustration for nurses. We hate having those situations because we have to think ahead, and if somebody starts to die, you know, to not know exactly what we would need to do is hard. So after I was done helping Nicole, I left the room, but Nicole stayed, and she stayed in there for a long period of time, even though there was a lot of other things she needed to get done. And she came out and she said she told me she's done. She said, I'm done with this, I want to die. And so Nicole called the doctor to kind of recite the story, and the doctor had said, you know, I'm too busy right now. And so Nicole said, well, I need to do it. So she called him and told him, you know, I just talked to your wife. She told me she's done. She told me she wants to die. I think she had said something like, I saw my son yesterday. He was 4. I saw my son, and now it's time. I'm done. And it wasn't what she said, but the way she said it was so compassionate, and she got him to understand. And so I just feel like if Nicole hadn't taken the time to be with that patient and really allow her to be heard, I don't know if the outcome would have been the same. It took a lot of courage for Nicole to have that conversation with the husband. I don't know that even I could have done that. I might have just said, you know, I'll tell the doctor and let her handle it.
On a daily basis, we are always questioning what we do, if it's the best and the safest thing for our patients.
It's about the patients, and there's just patients that you never forget.
It's truly a culture here of collaborative practice.
You can really see the difference in the interactions between caregivers here and how truly different it is. It's a really special thing we have here at Middlesex. And you know, I think we should all, you know, understand that and take a step back and realize how wonderful it can be.